We're at Insight Publications doing a roundtable discussion on the Affordable Care Act, and our panelists are going to introduce themselves now.
Joel Lingenhag, I'm the Director of Commercial Business Strategy for Network Health.
I'm Dustin McClone, I'm Executive Vice President of McClone.
Ashok Rai, President and CEO of Purveya Health.
Great. Thank you all for coming today. I'd like to start right in by asking you, what's the most pressing issue for your clients right now? What's on their minds, and what are you hearing?
Well, I think from our perspective, it's really just trying to figure out what decisions can be made and trying to sift through a lot of information. I think one of the things we know with the Affordable Care Act is it probably has more information out there in articles about it. A lot of them are not necessarily 100% accurate, and I think it gets a lot of people confused. So I think really what their biggest issue is, what impact is this going to have on our business? What are the key decisions we can make now or cannot make now, and what do we need to figure out to get to that point?
I would agree. I think the lack of certainty or predictability seems to be bothering businesses more than anything. Not only about the act itself, but the consequences of the act, what will happen to rates, especially those that are smaller employers are probably much more sensitive to very large swings in rates, not knowing what's going to happen, not having that sense of security. Not that they had much of security in the past, but they have very little to no security now.
I think there's just a lot of uncertainty, not sure exactly what is really in the ACA law. You may not like everything you have today, but at least you understand it to a large degree. There's just a lot of uncertainty is what we hear. People just aren't sure what they should do and what strategy to take for this year and what strategy to take for next year.
Okay. Well, let's dive right into what you know to be true. You've all been keeping abreast of the changes and following it daily, probably day by day, week by week. What do we know for sure?
Probably the only thing we know for sure is it's not going away. And outside of that, the law itself doesn't tell us much in our industry. It's the regulations that follow the law that are written that really guide how we practice, whether it be on the consulting side, the insuring side, or the provider side. It's the regs that are continuously being written, tens of thousands of pages a month right now. And there's certain aspects that we know for sure about structure and somewhat on where our plans need to be designed, or on some of that more popular stuff such as pre-existing conditions. But for example, if you take a look at the health insurance exchange, we still have another month to wait to see where our products rank on it and what it looks like and what's the usability of it. We've gotten to see some test sites, but they're very raw right now. So we are 4 or 5 weeks away from probably the most important purchasing center for those that are going to be moving into buying their own insurance, and we still have no idea what it's going to look like. And you only probably have 60 to 90 days on that exchange to make decisions, because most people's insurance that are going on that individual plan would expire on January 1 or December 31st. So all we know is it's not going away.
I need to interject here and say that this conversation is taking place the Friday before Labor Day. Our article will be coming out October 1st. That's the day. We'll know everything, right?
Yes. Well, I think I think all three of us would agree that's the day we think we'll know what's going on. But given the delays the government has had and given the lack of interaction we've had with the exchange, given the changes the administration has made at the last minute, such as with large group employers or even with government employees, we think we'll see something on October 1st, but there's no guarantee.
Yeah, I think when you look at the certainties, I agree. We know it's going forward. I think probably the key certainty is we know from a cost perspective, costs are going to go up. We know that. And probably the only other certainty we know is that it's going to be constantly changing. It's not going to be Y2K, where all of a sudden, either October 1st or January 1st, the lights are going to go off. this is going to be a change that's going to happen over time. And to your point, with the regulations changing, guidance coming out consistently that is saying one thing and then changing the next day, there's really no absolute certainty. But I think when I look at what employers need to be thinking about, the one thing that I think is maybe the silver lining in all of this is it's really forced everybody to take a step back and figure out what are we really trying to accomplish here? Why are we doing this to ourselves? And I think it's really getting companies to get back to why do we offer a benefits package? What does that need to look at for us to get them, keep the best and the brightest consistently? And so that I think there's going to be a lot of challenges to go along with that. But that's one of the things I think a lot of employers have tried to get back to, and I think more of them need to be focused on.
Mm-hmm. Joel, I want to ask you the last-minute change that Obama announced before the 4th of July about the mandate for employers 50 and more. Can you just address that, because that is the one most recent thing that has changed?
Well, from the employer perspective, I think it buys them a little bit of time. A lot of the larger employers already offer insurance, so I'm not sure it was as big of an impact as what it sounds. Probably more in the mid-sized market where you may have more employers who aren't offering coverage, but most of the large employers to compete already are offering coverage, and coverage that more than meets the minimum. So I don't think from that perspective it has a real big impact.
Mm-hmm. Although there was a lot of talk that was a big change. In fact, all it really is doing is giving employers with 50 or more employees more time.
Correct. And it also makes it more confusing in terms of the whole exchange world, and if they don't, they're not mandated to offer coverage, because if they have coverage, they're not supposed to go on the exchange. So I think it throws a little bit more mud into the waters.
Especially for certain industries, a lot of the large employers, I would agree, such as manufacturing, definitely have covered their employees. But then you go into the retail and hospitality industries where traditionally they haven't. And I think that's where we probably heard the most noise leading up to July 4th from that industry. There's some famous hospitality people that were going to, have the 29 rule. Nobody can work more than 29 hours a week, otherwise they'd be considered a full-time equivalent and then need benefits. So I think it's much more industry specific right now on the impact of that, so calling it just large employers. But it does throw a lot of confusion into the exchange, especially when the subsidy qualification, because that's really what people would go to the exchange for, is that they get a subsidy to help them buy the insurance. So does somebody working for, I don't want to use a name brand, so Hotel Brand X, do they get a subsidy? How is that going to work if their employer doesn't offer insurance, or does to certain employees and doesn't to others? It's creating a lot of confusion from that perspective.
I've heard too that the rule about minimum number of employees, this is talking about full-time equivalent in hours, not just sheer numbers of bodies. So companies like restaurants that hire lots of part-time people, or maybe even deliberately hire part-time because benefits are hard for them, they're going to have to offer some benefits if they have lots of, or if their full-time equivalent is.
Well,
Go ahead.
Well, I think that's a great example of how there's so many different calculators and calculations of everything that it's easy to think what you just said, that yes, you need to look at that from a standpoint of do they qualify for this pay or play calculation. But to Dr. Rye's point, then the next step is, okay, who do we need to pay a penalty for, either because we're not offering coverage or it's unaffordable. And so I think one of the biggest struggles is you can read a lot of these different regulations on how to calculate an employee and how to calculate their hours and all that other sort of stuff. And I think the struggle then is a lot of times it gets misapplied to the wrong calculation. And so I think that's what's creating so much confusion is we hear it all the time on the front lines that, well, we read this article that now we're going to have to do X. Well, no, you don't have to because of A, B, and C. But well, what about Y? Well, you don't have to because of X, Y, and Z. So I think that's really where the struggle is. I think employers need to really take a step back, and this is probably the biggest time ever that they need to be finding somebody that's the advisor, somebody that can be the healthcare reform expert for them. And whether that's McClone, course, would love that, but really it can be anybody that they trust, because no employer is going to have the time or ability to be a healthcare reform expert. I think I've seen a lot of employers trying to become that, and that to me is probably the biggest fear. Is I'm afraid businesses are going to make a decision based upon information they think to be true, but doesn't necessarily apply to them in that way.
It's an interesting paradox that you set up really a very complicated system, and then you have navigators who are not trained as thoroughly as agents to try to guide people through it. I'm not saying navigators are incapable by any means, but it's a very interesting paradox that we're trying to move people into one of the most complex products and trying to pick it online using minimal assistance in some cases. I think what you're going to see is new products coming out that are going to be even more complicated to actually, in some cases, try to counteract some of the provisions of ACA. Small group self-funding is a big one that a lot of carriers are looking at. So bringing that margin down, that in the past large employers only would self-fund, small groups usually stayed away from it. I think you're going to see a migration toward that, products developed for that. It's those interesting paradoxes. The 30-hour paradox is another thing, as employers are trying to bring part-time people below 29 hours. So now you could have someone who's working less hours and still not getting coverage. So again, sometimes the unintended consequences of the laws end up impacting individuals.
And even the subsidy calculation, so as we talk about the individuals and small businesses, understanding what your subsidy is going to be, what it's going to be based on, and the penalties if you got a raise. I mean, the things that are, because it's going to be looking at a retrospective W-2 and your taxes, but prospectively, after you've received the subsidy, we're going to check it on what you made the following year. So it's going to create a lot of confusion and fear, which it already has in individuals that don't know what their subsidy is going to be. And a large portion of America, we've heard different numbers, but up to 300 and something % of the federal poverty level will be able to qualify for some sort of subsidy on the exchange. So we're not talking about a Medicaid population here. We're not talking about an hourly population here. We're talking people that could be borderline six-figure income here, being able to go on the exchange and getting some sort of subsidy. So it's a large portion of America that doesn't know what they're going to be getting. And have if you really think about the timeline, a very short time to try to figure it out.
Yeah. How will it benefit or impact employers who are very small? They will now perhaps have an option to help their employees purchase insurance. Maybe they will help their employees fund the purchase of their own insurance. What is going to be happening?
Well, I think define small maybe.
I'm thinking very small companies, 10 to 29 employees, really small companies.
So if you look at groups in that category, I mean, it is going to be varied a little bit as to, what options are they going to have. I think one of the key things that a lot of people are getting confused by is these exchanges, is if these exchanges are going to be suddenly a plan that has a cost advantage over everything else. In reality, all the exchange is essentially a way for the government to direct subsidies to purchase the insurance that pretty much existed already. So it isn't this holy grail. In fact, you can talk from an insurer's perspective, but from an insurer's perspective, it really is going to drive a lot of adverse selection, where some of the worst risks are going to be the ones going to these quote-unquote exchange plans. And it's why a lot of companies have decided not to participate, simply because that, I always look at people...
Companies that offer insurance, you mean?
No,
Insurers.
Insurers. Okay.
Yep. From a company perspective, yes, there's going to be options. They could, increase the employee's compensation to have them go, buy individual coverage. I think the big thing that most people are missing, though, is individual coverage now is going to be, in the long run, more expensive than group coverage is going to be, because individual coverage is going to look like group coverage. If you went and bought individual coverage over the past 5 to 10 years, the cost was pretty good, but it didn't cover nearly the same things, and carriers could decline or put riders on or restrictions on. Well, now that's going away. So it kind of goes back to Insurance 101, that a bigger pool of bad risk doesn't mean a better pool. It actually means a worse pool. And so I think a lot of companies are going to have to look at that. I think that's the good thing about this, is it's forcing companies to really think about what are they trying to accomplish. But it's really going to come down to, okay, you got 15 employees. If you stop offering health insurance, can you attract and retain those people? The answer is yes. Well, that answer probably was yes before, too. And so that might be a good business decision. But, from an employee's perspective, if they just get more compensation, that's going to be after-tax income. They're going to have to then go out and buy their coverage, which, again, is not going to be any less expensive. So maybe they get choice, but choice from an employee's perspective when they don't really know what they're looking at is not necessarily always a great thing. We've seen when we've offered even 2 plans in a company, that creates a lot of confusion. I can't even fathom when suddenly the provider networks are very different and the plan designs are different, and having an employee trying to make that decision on their own. I don't think it's going to be quite as easy as a lot of people believe.
When you think about choice, the only choice difference really materially would be networks in some cases. Because basically the benefits are mandated, so benefits are going to look very similar. You're not going to see the differentiation that you see today. I think the other thing is that some people don't understand is Wisconsin already had guaranteed issue for groups. So if you were a group, we had to write you. The only thing is we could price it differently. Now with the community rating, everything's priced the same. So you're basically taking the risk, you're spreading it out, and everybody pays a little bit more to keep the rates uniform.
All right, okay. And the impact on the very small employer, or let's just say an individual purchasing insurance, let's talk about that a little bit more, because it will be, employers who are consultants, one-man band type thing, and also individuals. They're all going to be individuals.
Those that are relatively young and healthy right now that are on the individual market are probably going to see some pretty significant sticker shock as they go to buy individual insurance in the future, because we lost the creativity to design a plan around that individual now. Health insurers were able to say, what are your needs? If you're not planning on having children in the next 5 years, you don't need OB coverage. If you're relatively young and you don't need pharmacy coverage, or you don't mind a really high deductible for meds because you don't think you're going to need medication, we can adjust that. Now, because there's a significant amount of mandates in the ACA of what needs to be in a plan and how it is delivered and caps on deductibles, all that flexibility goes away. So everybody's got to pay for basically a Cadillac when they might have just needed a Yugo. And so if you're relatively young, say under 50, and you've been relatively healthy, and you had health insurance mainly for catastrophic reasons, which is primarily why that age group carries it. Preventative medicine under 50 isn't as expensive as preventative medicine is over 50. That's when we start getting the mammograms and colonoscopies. So under 50, there's a little bit of preventative, and a lot of people carry insurance for that catastrophic event. Now they're going to be paying for as if they need all that care, all those medications, all those tests, even when they're in their 20s. So their pricing is going to be like they need it all, even when they're in their 20s. And you're going to see probably the most significant sticker shock and disappointment, I think, in the American public in that market. And it's interesting to note that, I don't know, I think that network could say this too on a consulting end, it's one of the fastest growing markets out there is individual plans. As companies have given stipends, or entrepreneurs have gotten their own health insurance. So one of the fastest growing markets is going to see some pretty significant changes come January 1.
The other thing that jumps to mind is the paradox. Remember I mentioned before the paradox. One of the things that is needed to make this successful is an infusion of the young uninsureds, the so-called invincibles, or the ones who think they're invincible, so they don't carry insurance. Because they're young, healthy, so they either take a catastrophic type plan, $10,000 deductible maybe, and if something happens, they have some protection, or some choose not to take it. That's who they need to draw into the market to be able to offset the higher costs of bringing down the coverage for the older population, because they've compressed the age bands from top to bottom to within 30%. So by moving up those rates of the young and insured or uninsureds, now how are you going to draw them in if the rates are 3-4 times higher than they are today if they're not taking coverage? And then they're looking at a penalty of $95 or 1% of income. Well, again, their income would have to be pretty high to offset the premiums that they'll have to pay. So I question whether we're really going to get that infusion of the young uninsureds that they're banking on.
And without that, the cost to the insurers, and the government has promised some reinsurance to those insurers on there, but this could get very, very expensive for the government if those young individuals don't come into the marketplace. Because then you're going to be insuring everybody who is sick. That's like buying car insurance, knowing that every year you're going to have a car accident.
Right.
Yeah.
But they'll be required to purchase insurance.
The requirement's pretty weak. You know, you really look at the penalties. So say the insurance is going to cost you $10,000 a year. Well, you'll have to have a pretty significant income for that penalty to even matter to you.
Well, and the big thing with the penalty, I mean, first of all, it's pretty small. I think if you look at Massachusetts as their guide, I mean, their uninsured rate barely changed at all, and their penalties were a heck of a lot more than the federal. So we've already have kind of market experience that, I mean, I always look at it this way. You know, we've been in this business for over 60 years. I have never seen people sprint to, hey, I want insurance. People don't like insurance. They don't want to deal with it, and I don't think there's going to be this huge infusion, specifically of people that are probably not as dedicated to learning about insurance to begin with, under 30 crowd, so to speak. I just don't think they're going to sprint to, hey, can I spend a bunch of my money on insurance that is going to be really expensive that I don't really feel I need.
You see them opting to pay the penalty.
Well, I think you got to think about how they're paying the penalty. I mean, they're paying the penalty through their taxes, and if you think about what's the number one way people pay their taxes today, it's TurboTax. So they press a button, boom, I got a refund. So, to me, when I look at how this world is going to look, the penalty would have to be so significant that somebody would actually become aware of it and make the decision of, okay, I'm going to pay X number more in taxes versus my premium. And I just don't see that really happening anytime soon until the penalty gets tremendously significant.
It's not a big enough number.
No.
It's a very small tax. In a tax bracket market where, like was mentioned, they're likely going to get a refund.
Mm-hmm.
So this is
So you get a
most
little less
likely
refund.
going to cut into a refund rather than actually being, nobody's likely going to write a check.
Yeah.
The penalty.
Oh.
So you press a button. I mean, do you think most people, when they press TurboTax, they actually understand what calculated their refund? Most people don't. Most people don't look into it, and so
Not in that age crowd.
Right.
no. So
So the question is, those folks that will opt for the penalty versus purchasing insurance, when they get sick and need to go to the hospital, where is that coming from?
Then they're going to be right back on, the providers are going to have to absorb that cost to provide them care. And that's going to be, once again, spread right back to those who are paying the health insurance.
Which is much how it is now.
Which is going to be the
Exactly.
government.
Goes back in the system.
It's going to go back in the system. So
So those
We
people
haven't
who
fixed
can't
that.
afford it, well, if they can't afford it, they'll write the checks, and if they can't afford it, they're Medicaid people, or that
well, it
Government.
depends. They may not be. They may be in that middle. They may make $75,000 a year. The penalty per se wasn't really a penalty to them. Now they've had something catastrophic happen to them. They're not going to have health insurance at least for another 6 to 10 months. They're going to incur costs that they can't take care of. We haven't, two things this act didn't do. It didn't really encourage more people that we needed to go onto insurance, have insurance, and it did nothing to make the country healthier. There's no incentive for you to use your insurance. The ability to pay doesn't guarantee the ability to good health. And so the act doesn't address the two key components that probably needed to be addressed the most. So we're spending an afternoon here and countless hours in Washington debating a act that probably didn't accomplish what, when you would have thought America had an opportunity to fix its health insurance and provider system, what would you want to do? You'd want a healthier America, and you'd want everybody to have insurance, neither of which is happening in this act.
Agreed.
When you think about it, it's called health care reform, but really 90% of it is geared at health insurance. I'm trying to change the health insurance system, but very little really to how do we improve the quality of care. Now, one of the things that I see that could be good coming out of it is a return to some of the things that we got away from. I think you're going to see a return to more tightly managed care plans in the future. That we kind of resisted back in about the 90s, I think, where there was pushback, we want choice, we don't want someone to tell us what to do, etc. That a lot of providers or a lot of carriers are looking to how do we partner with providers to better manage the care and get people aligned with a primary care physician, as an example, to really manage that care, maybe even going back to gatekeepers, which is, again, a term that people got really, they didn't like that concept. But if you're looking at potentially reducing your premiums, if it can significantly do that, I think people's tolerance level is going to go up. Whereas before, insurance, I can't use the term cheap because it wasn't cheap, but there was not enough of a driver that you could use that for. And everyone got to really open panel, open access, go to whatever specialist, and the people were self-managing. Well, I certainly am not qualified to self-manage my care. So I think that's the positive that could come out of it. And again, that goes back to hopefully creativity, that we see a problem and we've got to work to try to figure out how can we address it, how can we live within this. Because as it was said earlier, it's not going to go away.
So, so in fact, we may see more people going back to the primary care physician model where they have a gatekeeper who helps them determine what happens next versus just going to some specialist.
I believe that that's going to be coming, yes.
We'll see a lot more of that, and that needed to happen anyway. What happened in the 90s, and care wasn't managed, and managed isn't a bad term, especially when it comes to your health. And now we have the technology that we didn't have, or most of the country has the technology now that the majority of the country did not have in the 90s. With electronic medical records and the ability to know what a patient is doing, we have more data now over the last 10 years than we had the previous 30 years. We have the ability to know if you're behind in your care. We even have the ability to know if you're not filling your prescriptions. And now we're able to manage that. So there are certain incentives created by the ACA for providers to work with health insurance companies, or to do what we did as a provider system, open up your own health insurance plan, like our colleagues in Appleton had done many years ago, because now we understand that we can manage that care and actually probably do a better job because we have the data, versus, say, national health insurance companies who really don't have the kind of skin in the game that the physician providers do. So that's probably, 10 years from now we'll know if that was a good consequence or a bad consequence of the act of providers getting back into the insurance field.
What are some positive things that might be coming out of this? There are some things that will help people know that they won't be turned down for insurance, pre-existing condition, that sort of thing. That up to age 26, being able to be on your parents' plan. Let's talk about a few of those things that are going to be good.
Well, I think if you look at the positive side of it, I think it's probably more positive in other parts of the country than it probably is here in Wisconsin. A lot of the issues that this was meant to address with trying to get coverage and all those sorts of things, we didn't really have that issue much here in Wisconsin, because if you couldn't afford it, we had Badger Care, and if you couldn't get it, we had Hearst. So we didn't have as big of an uninsured population issue here in Wisconsin. So in some ways, we're kind of, that's in some parts of the country that is a benefit because that didn't exist, but we're kind of paying for it and not necessarily getting the marginal benefit, I would say, that other parts of the country are. So, I mean, certainly my opinion is that I think there probably would have been easier ways to fill that gap than probably the way we did. It was a gap that needed to be filled, and certainly in certain parts of the country. But if I were to say what is the positive, it's probably more the silver lining. I don't know if it's a positive, but I think it's forced people to get back to thinking about, why are we doing this to ourselves? I think there were a lot of companies that just every year were taking an increase and saying, well, this is just the way it is, and this is just the way it is. And I think it's forced people to kind of take a step back and say, what do we really need to do? And actually spending some time on, talking to people on what are next steps and what do we need to do to be strategic and competitive and all that sort of stuff.
I would say that there's been a huge increase, and I think you probably see this more than either of us do, but we've definitely seen it just from our customer base of small to large employers really focusing on the health of their employees for the first time, not from the perspective of I'm going to take care of you when you're sick, but I'd really rather you not get sick because of what it's costing me. So the focus on the delivery of not only the traditional, let's look at your risks and HRAs or health risk assessments, those have been around for forever, but actually doing something with the data now, that's probably one of my, biggest problems with HRAs is that, being a physician, you see you probably got to write a prescription, and people are actually handling it better now. But you're seeing, employers actually understanding the return on investment in the investment in their employees' health. And, for certain of our employers, 30 plus, that means an entire clinic inside their factory. To another 800 or something employers that work with us, from anything from on-site fitness to dietitian on-site. So we're starting to see employers really focus on that healthcare dollar, knowing that the costs aren't coming down, but understanding that if they want to continue to offer the benefit and afford to do it, they need a healthier workforce. In the past, it was, I have health insurance for when you and your family get sick, which is still, I think, the large majority of it. The tough part for us in Wisconsin, in this area of Wisconsin, with such a strong manufacturing belt, is that there's such a high competition for skilled labor. This will still be the ultimate benefit to attract skilled labor in our area. And as we start to see a shortage of skilled labor coming into northeast Wisconsin, I don't see the option not to offer it coming to fruition.
Agreed.
Well, could it backfire in that employees might decide, well, I don't have to work for a large company because I don't have to worry about my health insurance. I can get my own health insurance.
Mm-hmm.
Yeah, I think we'll see what happens with the labor market on that, because the health insurance is still going to cost that individual employee something. Somebody's got to pay for it one way or the other. Whether it's through a compensation adjustment for the small employer paying less but offering health insurance all of a sudden, or having to the large employer being able to be competitive in that market. Somebody's got to pay for it.
And I think, one of the key things is, Joel mentioned it, a lot of these plans are going to shift to more, not a traditional fully insured model, but where you're actually paying for the claims that happen. And what's going to be real interesting about it is it's at least our belief that because of the wellness programs and really driving down risk in organizations, those employers that get aggressive at this and it can actually control the underlying cost, they're going to have a huge competitive advantage over the individual market, because they're kind of going to be the last underwriter standing. Insurance companies can't underwrite under 50 anymore, and so these smaller businesses that can actually differentiate premiums based upon health risk assessment scores and what people are doing to get healthier, those employers, even smaller employers that are going to do that, they will be able to be a magnet for good risk, because they'll be able to give those people kind of an artificially low premium because they're contributing, but they're also giving them a deal because they're being proactive on their health and actually affecting the risk. Whereas in the individual market, you're going to be in the group with those that aren't working, those that either can't work or aren't working, and lower incomes that are getting the subsidy, which that's a lot of risk for an insurance company. So to answer your question, I don't know that I see a huge amount of that. There'll be some of that, but there kind of always was that. There were plenty of people that would go off and, 10 to 15 million people in our country were insured by individual plans previously.
Will small employers, the under 30 employees, will they finally see that maybe it makes sense for them to offer insurance to their employees? Is that, or quite the opposite?
Well, it's not getting any cheaper.
No.
It's not going to be cheaper, it's not going to be easier. So the incentive really is going to be, what's my disincentive, what's my penalty?
Right. It becomes a very financial decision.
And why didn't they offer it before? My guess is the reason they didn't before is either they couldn't afford it, which means that they couldn't afford it and they were still in business. They somehow found a way to attract and retain the people they needed to run that business. And so, yeah.
So it's moot.
Yeah, so I don't know. I don't see a whole lot of people adding it. There was some studies recently that actually said there might be an uptick in more employers offering coverage, but I think that's before anybody's seen the cost of it. I think most businesses, if you haven't built it into your margin yet, you're probably not going to add it as an expense.
Will the cost go down for any group? Those people who are currently paying very high premiums because they have chronic conditions or they're older?
The HRSA group, the high-risk group definitely should go down. The over age 50-ish, probably in that vicinity, could see decreases, although some of that could be a little bit offset by some mandated benefits. So you're comparing apples and oranges. I mean, it's so different. But definitely with the rate compression, you paid more as you got older. Now that's coming down, and the younger are supposed to pay more. But again, is that sustainable? It's all built on that belief that you're going to be able to attract and retain those younger ones. It's interesting, New York just came out with within the last few weeks and said the premiums are going to be 50% lower under the ACA. And I was really scratching my head because I work for a New York-based company and I know New York is not cheap. So how could they be going down? And doing a little research found out that when they went to the guaranteed issue, basically the only ones who took it were those who were sick and the older population, so the premiums shot way up. They could not attract the young. They're making the assumption that they're going to attract an infusion of youth, bringing the premium in, but not bringing the claims with them. And that's what they're basing that 50% reduction on. What's going to be interesting a year or two from now is, are they right?
Yeah, I mean, we've talked about it a lot. There is going to be a temporary group that is going to benefit from this. The community rating model, those that were the most sick and unhealthy, their rates could stay the same or even go down, are some predictions. But that's such a temporary issue because if you look at it from a bell curve standpoint, if the high end of the bell curve is getting a good deal and the lower end of the bell curve is getting huge increases, the lower end of the bell curve is just going to hop out. They're going to go into a self-insured world. Well, if you're an insurance company and the bottom 20% hops out of the market, that bell curve is moving. Yep. And that's, there's going to be some artificial, there's some reinsurances and things like that. They're going to artificially hold that down for a period of time, but it's just a bubble.
Yeah, it isn't a permanent fix at all, which is why you see a lot of companies only putting a toe in the water or a lot of insurance companies when it comes to the exchange,
This year, starting in 2014, there's only a certain list of insurers that are going to be offering something on the exchange. I don't think any of you are going to. Purveyor will.
QHP. So Purveyor 360 with Dean as the backdrop is on the exchange in all the counties that we work within, but we have no clue till October 1st what that means, because everybody submitted rates. You don't know where you're going to land, if you're going to be a viable product or not. And more importantly, you could be a really good product. You could have a really good price, but if the consumer doesn't understand that, they could be purchasing something that either they don't need or isn't going to deliver that what they need because they have to research what networks are available, who's in those networks, and by networks we mean provider networks, the hospital, the physician, the therapist that they're used to seeing. So it's going to be a very interesting late fall for us.
Yeah, and I think when you look at what that's going to mean for employees, I think one of the biggest risks that scares me is, employees or just individuals making that decision based upon, what they see on a website and really not knowing what they're buying. I mean, to Joel's point, there's articles that are coming out, California, when they come out with their exchange, the headline was that plans are less than expected. Well, it was because they were comparing apples and oranges plans, and the provider network had 30% of the docs in versus 80% of the docs in. Well, yeah, that's going to be a different price, but are you really comparing the same things? No, you're not. And my fear is that, there are some credible companies such as yours that are going to be on the exchange, but there's some of these companies that are just popping out of nowhere that are going to be on the exchange. And the question I have is are they sustainable? And, what happens when something goes wrong? I think one of the values is we've got a lot of local companies that can deliver this, that if something goes wrong, a wrong can be righted.
You have a couple companies that have never really done any significant business with provider networks in Brown County, for example, that are going to be offered on the exchange in Brown County. They really don't even have a network, per se.
I did see some unfamiliar names on that
You
list.
could be purchasing, yeah, exactly. I'm trying not to.
Yeah, California-based, I think,
Yeah.
and it's like,
It's a for-profit, and I don't want to, be negative until we actually see how things are delivered, but what's a national company's commitment to a local community to maintain a network so the product you bought you'll actually be able to use?
Right.
And there is none. There's literally none, and there's no federal. There are some federal guidelines that are going to make them have a usable network, but there are ways to, make it look like it's usable and create enough barriers so you can never use it. And so we're worried about the encouragement of people who don't live in our local communities, who don't do business in our local communities, finding this as an opportunity to take locally owned premium dollars and the profits from them and take them to Wall Street or take them to investors and not reinvest them in the community. And that's a negative to the exchange that we have no control over.
the opposite side of that equation, the other extreme sort of, is like the co-op, which is new and not a bad concept, but I wonder, it's difficult enough to navigate the insurance industry today and going into 2014 if you have the experience. Coming in new, it's like, that's a lot.
Yeah.
So you wonder that whole thought process of bringing new players in to a very dynamic, complex, quickly changing. I mean, we just finished our filing for our rates for October 1st, and just that last week, the number of times we had to change decisions because information changed or we found out something, it was pretty much a daily basis. And then I think about someone who's not familiar with it. It would kind of concern me.
Yeah, the thing I keep going back to the exchanges is, and I say this a lot, I mean, McClellan, we've been in exchange for 60 years. People come to us, we have to figure out what are their needs, and then we turn behind us and we look at the different carriers and the different plans that are in the market, and we place them in, and that's going to be the exact same going forward. The only difference is we're going to have one more option where we're going to turn around and we're going to say, okay, based upon your income, you're eligible for a subsidy. So if you want a subsidy, these carriers that are in the exchange, this is what their plans look like, and with the subsidy, this is your end-all premium. Or if you don't like those options, you can go out of the exchange, and then this is your premium that's according, and you make that decision. So it really is just, it's not creating a whole new world of a plan that never existed. What it's really doing is just enabling people to get some subsidies to offset some of the cost.
So how
It can be
is,
delivered in a variety of ways.
Yeah.
It can be delivered in so many different other ways.
Yeah.
the way that each of you do business, how is it going to change? Are you going to be relied much, much more than ever upon to be the information houses and What's changing for you?
We have it on both ends. We have patients because we, our healthcare provider. We have 3 partnered hospitals, and so our 1,500 employees need to know how to answer questions because patients, especially those that are individual insurances or small groups or don't have, a brokerage company working with them or a consulting company that's working with them that's actually educating that, which isn't all of them. I mean, they're going to come to their provider saying, what do I do? So we're seeing that right now. We're seeing a lot of that. And on the, the health insurance side of it, there's just so many questions that it's creating a negative influence. In a time where we really should be focusing on making America healthier and being more progressive, you've seen healthcare essentially stand on the sidelines or even regress a little bit in the last 18 months.
Right.
It's much more about what the regulations are, the facts, and ciphering all this stuff versus delivering.
The last thing we needed was on 100,000 pages of government regulations.
Yeah, I mean, there's millions of dollars being spent on just compliance right now. Compliance and understanding. And those same dollars could have been reinvested into getting people healthier and actually getting at the root cause of this thing.
Heck, you could have spent the $100 million on new regs, on the subsidies, and this act could have been affordable.
Mm-hmm. Yeah, amazing.
Well, it's called that, isn't it?
Yes.
Yeah.
All right, great.
Well, and you're absolutely correct because there's a lot of administrative costs that's being added, and not necessarily value, but cost. So that has to be absorbed. As far as how it impacts us, we basically are changing the way we do business. I mean, we've been our biggest tool was underwriting up front in terms of selection. Groups, small groups we had to take, but we could price for it so we could handle it. We had a tool. Now all the tools that we're familiar with are taken away, and we've got to come up with new tools. So we're in the process of figuring out what tools do we have on the back end in terms of managing the care, watching for our risk adjustments and things like that. It's a fundamental change in the way that we do business.
Yeah, I think for us, I mean, people have never needed an advisor more than they do today. So in some ways, and it's been good from a business perspective, but unfortunately, I don't like the way in which it's a good, because it's affecting businesses, and we're an employer as well that has to deal with this stuff. So that's a challenge, but I think the biggest thing that we see in our business is it used to be extremely easy to put up a shingle and be in our business. There's probably predictions over the next 3 to 4 years. There might only be 10 to 20% of us standing because so many people can't stay up on this. And the unfortunate thing is, I think back to our company when my grandfather started it, and he wouldn't have been able to handle this. You need so much manpower to stay on top of the regulations and the changes to communicate back to your clients, that a lot of the smaller shops, they have really good people, but they're having to get join forces with larger organizations and being acquired because it's just too difficult for just a few people to stay on top of this stuff.
Training alone and just keeping abreast.
We have teams. We have outside resources that are national resources and attorney firms, and we have teams dedicated to just scouring through this stuff every day, which is not. Talk about wasted resources. I mean, these resources could used to be dedicated to other things, and now we got to refocus them.
Saddest thing from a physician perspective is you have a health care act, and the only people who made money were the lawyers.
Yeah.
Very true.
Yeah.
And that's literally what we're seeing right now.
Yeah.
Right.
You look at the consulting companies out of Washington that are helping the local consultants. This is everybody looked at it as a small business killer from an affordability standpoint, but probably one of the largest small businesses in a lot of our communities have been the insurance brokerages and the consultants. And not only does this make it harder for them to maintain their business, and Dustin can definitely talk more to this, but then you come out with a whole new profession to compete against them that's government funded called navigators.
That's right. That's an actual term for a person
right.
who gets a certain certification, but they don't necessarily have the depth of experience at all.
Correct.
The qualifications and what type of training. I remember they all have to get trained in let's see, 30 days.
Yeah.
Yep.
Yeah, I mean, I look at it as a lot of people in our industry have looked at these navigators as a huge competitor, and my comment to it is, if we can't compete with people that have that level of training, then we don't deserve to be in business.
Right.
I mean, frankly, that we're used to competition and we welcome it. So, I mean, the navigators, I think the concern I have is misinformation. And I think we're already seeing that, and I think we'll see more of it when
It's
those
going
are up and running. Yeah, it's
to
going
create
to.
noise.
People are going to come in and say, "Oh, well, I was told this," and "Oh, no, we got to explain it this way," which, we're happy to do. But again, going back to I always look back to if they just talked to people like us before this thing went in, I think we could have. There might be easier ways to fix the issues that did exist. I mean, we needed a change, but I don't know if this was.
Would have been a novel concept to have a group of people who actually work with it come together and develop the solution rather than politicians.
Yeah, from a provider perspective, it's been very frustrating from a physician perspective. You get one kick at this can. You really do, to redo how we provide healthcare in America. And I've been on obviously the practicing side, still do a little bit on the administrative side, and running a healthcare organization. Now on the insurance side of it all, there's so many opportunities to fix a system that I grew up in. It's broken. I've been a patient since I was 18 months old. It's a broken system. Unfortunately, we haven't done anything to fix it. And that's not a political comment. That's not a Republican or a Democrat comment. But you get one kick at this can, and we couldn't get people to get along and listen to people who are providing the care and delivering the insurance to say, hey, we have some ideas. We see this every day. And probably the saddest thing and the proudest thing, the president launched his healthcare reform activities in Green Bay, Wisconsin. His first town hall, his first speech was at Southwest High School, and he came there because he stated Northeast Wisconsin had highest quality, lowest cost, or one of the highest quality, lowest costs, and he was there. But right after that speech, he got on a plane and left. It didn't come back to ask us why we had the highest quality and the lowest cost.
Good point.
And that was a really good day and sad day for us in this part of the country, because there are options to fix it. Right?
So come October 1st, where are people going to turn? What do you expect? Everybody will look at the same...
To McClone, of course.
Yeah. and they'll pick the local provider brand on the exchange, which will be us.
Yeah, there you go.
We're the only, I think, you are on the exchange.
We didn't go on the exchange, no.
So we'll be the only local company brand on the exchange in Northeast Wisconsin.
Rise is on, isn't it, too?
Oh yeah, they are. Only in certain counties, I'm not sure, but they're Madison owned, but yeah, also
That's true.
based. But the only real, headquartered based here,
That's true.
it will be us.
And
We'll see what happens.
certainly the others may opt to go that way. I don't know, is Network looking at it still?
Well, we'll look for 2015, and there's just so much uncertainty. You had to file your rates and your plan so far ahead of time that we just couldn't. We didn't feel comfortable being able to get everything together and feel comfortable about what we were doing because there's just so much uncertainty. So at this point, we'll be playing off the exchange, and then we'll reevaluate it to see if 2015 we want to enter that or not.
And we have no idea if this is a good business decision or not. I mean, us being on the exchange and Network not, there's not a positive or negative to either of our decisions because there's so much unknown. We did it as a local company, and knowing that so many of our patients were going to be moving into this situation, we wanted them to be able to at least identify with the choice and the name they knew. So they at least knew that they could continue to see their physician, continue to have their children seen by their pediatrician, not have to make significant changes, so they could look at our brand and choose it.
So what do you envision the future might hold? If you had to say today, 3 to 5 years from now, do you have any clue what the landscape is going to look like in health insurance?
Well, first thing I'll tell you is whatever I say probably could be extremely wrong by the time we get there, but I think what I see a huge trend to, I think there's going to be a large percentage of employers going to these self-funded plans because this avoids a lot of the negative impacts specifically on small plans. And I think what that will do is get people to see what the actual underlying risk is and therefore start attacking that risk. I think a lot of companies just threw up their hands in the past rather than really getting at the underlying risk. I tell people this all the time. I kind of view this whole thing as you know, a cold football game. You know, the weather's terrible, but we're all in it. So you got to find out between you and your competitor who's going to win. It's below zero and you're both miserable, but you got to find a way to get that advantage so that you can come out ahead. And that's really what it's going to come down to for a lot of businesses is you can bury your head in the sand or you can step up and say, hey, this is another way for us to create that advantage.
Okay. What do you think, John?
I think that innovation is going to be very important going forward, trying to figure out whether it's self-funded, more managed plans, the infamous narrow network, whatever that means or looks like. You know, those are terms that can be thought of different ways, but I think the idea is and I like Dustin's analogy because we really can't just ignore it and expect it's going to go away. We have to deal with it and figure out, okay, how do we deal with it? I mean, when Guaranteed Issue came for small group to Wisconsin, there were a lot of people like, this is the end of us, you know, we can't underwrite anymore. Well, we could. We had some different tools than what we had. We adjusted. I think we'll adjust to this, but I think it's going to look somewhat different. I think there's going to have to be some evolution because I don't think everything that's in place is going to work. Some of it's going to work okay. Some of it won't work at all. Some of it may even work well. I mean, you mentioned before about the good things. I think that dependent to age 26 actually has probably become somewhat popular, especially with the economy not being good. Anyone who's at a college-age child who finished school and didn't get a job right away appreciated that. So it's not that everything is necessarily awful, but I think it's going to have to make some tweaks at least or some changes because I don't think some of the things are going to be able to be sustainable. But I think that the private industry is what's going to have to continue to adapt and grow if we're going to thrive.
Mm-hmm. Dr. Riley, I'll give you one last word, then we're...
All right. Well, I would agree with a lot what Dustin said. As we look forward in the next 5 years, hopefully those that haven't been paying attention to why their health insurance costs are where they're at will start to understand the risk and understand what they can do about the risk. And as a provider, that makes me happy because that means we have an opportunity to engage a population about getting healthier because that's obviously the only way you're going to adjust risk. Mm-hmm. And you think about it in business, what business doesn't want to control its costs? Supply chain, you have every understanding where your vendors are at, what's going into your cost. Your labor costs, you can understand what your salary is at, what's competitive. The one aspect of cost, which is probably the second most significant cost outside of your overall labor cost, is your health insurance. And it's the one thing that employer after employer has just accepted and written the check. They've taken the 15s and 20% increases. For the first time, they're actually sitting down with us as providers and saying, all right, help me get healthier. Help me stop spending so much money with you. And we're engaging in that conversation because we understand we're going to get paid differently. So finally, employers are coming to us and saying, I'll actually pay you to keep my employees healthy. And that's part of, or that'll get us most of the way there as a country to start changing our perspective about healthcare insurance. But till the purchasers of healthcare insurance woke up and realized that they could do something about it, we have not been able to have that dialogue. And the large companies, to a point, got it, but then they also were so large that they couldn't figure out how they wanted to do it. It's the small companies, the 250s and unders that are self-funded now, and the 50s and unders that are going into self-insurance and understanding their risks. That's a really unique audience for us to engage over the next 5 years. So I think that's going to be a positive thing from what's going on right now.
Okay, great.